Hello my dear students, I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and I love it. We are going to study the femoral triangle today. I know you've been studying, you study this right the day you come to medical college. Usually it's either femoral triangle or it's then upper extremity. So you know quite a bit about it. But let's run through it with a different angle and run through it in a way we will remember. As usual, whenever you attend my classes, I request you to keep color pencils or any drawing implement ready. Request is when I ask you to draw, please draw. It will help you to recall better. So some questions before we get into the topic, students. Following our branches of femoral artery given off in femoral triangle, you can see a series of arteries. I'm sure you know this. There are some other questions asked, like write a short note on femoral nerve, or describe inguinal ligaments, or what is meralgia paresthetica. You may have some idea about some of these questions, okay? But to know all of them, let's begin to learn the femoral triangle. First question, let's define the femoral triangle. Where is it? It's a depression below the fold of groin in the upper medial side of thigh. Ma'am, it makes no sense to me. Yes, it makes no sense to me either, because can I see it? Yes, I can see it. So let's see it. Let's see where the triangle is. So you can see this man standing with his leg flexed, abducted and laterally rotated. Can you see that arrow and there's a nice little triangular depression there? So in a thin person, you can see the femoral triangle there as a depression in the thigh. In fact, you can try it yourself. Stand in this manner. It might be good for you to exercise a little bit once in a while. Okay. So yes, femoral triangle is a depression in the groin just below the inguinal ligament, which can be made out if a person is standing in this manner clearly. Right. So femoral triangle is a triangular space. We study it as boundaries, apex, base, roof, floor, contents, like we study any other triangle. So let's begin. Boundaries. It has a lateral boundary, medial boundary and a superior boundary. The lateral boundary is formed by the medial border of sartorius. Please note medial border of sartorius. The medial boundary is formed by the medial border of adductor longus. And the superior boundary is formed by the inguinal ligament. So you must remember which border of which muscle. Medial border of sartorius, medial border of adductor longus. What is the base then? The base is the inguinal ligament. If there is a base, there has to be an apex, correct? So where is the apex? The apex is where the sartorius comes to overlap the adductor longus. That point here is called as the apex. So students, what have we learned? We've learned the lateral boundary formed by medial border of sartorius. Medial boundary formed by medial border of adductor longus. The superior boundary formed by inguinal ligament, which also is said to be the base of the triangle. The apex is where the sartorius crosses the adductor longus. Got it clear? Boundaries? Right. Let's now go to the floor. Again, very easy. From lateral to medial side, the floor is formed by, take a look here, ingua iliacus, psoas major, pectineus and adductor longus. Remember, adductor longus forms the boundary as well as the floor. Sometimes you may have a little bit of adductor brevis coming through between the pectineus and adductor longus. Right, so we've got our boundaries, we've got our floor. Should we draw this to consolidate our knowledge? Okay, take your color pencils, take your drawing sheets. Let's begin a diagram. Right, students, are you ready? Draw your anterior superior iliac spine here. Draw the pubic tubercle and the pubic symphysis. Connect the two with the help of a green colored chalk. Draw the inguinal ligament. This inguinal ligament forms the superior boundary of your femoral triangle. Now draw your sartorius. The medial border of sartorius will form the lateral border of femoral triangle. Now draw your adductor longus. The medial border of adductor longus forms the medial border of femoral triangle. Now draw your iliacus, psoas major and pectineus, and there you have the boundaries and floor of femoral triangle. Having got these concepts clear, let's come back. Right. So I'm very happy that you drew this diagram. It will help you, it kind of brings you into the class. Now it's your job, dear students, to study the following muscles on your own, because the class doesn't give you time to take all this for you, but you must know the anatomy of sartorius, iliacus, psoas major, pectineus and adductor longus. Also study the inguinal ligament. Now that you've studied this, let's go to the triangle. What do we have? I have the boundaries. I have the floor. What must I now have? Yes, I must now have the roof. So what are the structures that are forming the roof of the femoral triangle? Understand that the roof throughout the body is always made up of skin, superficial fascia and deep fascia. Okay. So again, superficial fascia has a lot of contents. What are the contents? Subcutaneous fat, arteries, veins, nerves, lymph nodes, others. Okay. So now let's understand this. This is your general information. Whenever you are attempting any triangle, okay, always understand that it will have a roof formed by skin, superficial fascia, deep fascia, superficial fascia containing these items. Okay. Right. So let's begin the contents of the roof. The roof consists of subcutaneous fat, which we have removed. Arteries. Can you see a lot of small arteries here? These are superficial branches of femoral artery. If there is an artery, there has to be a vein. So there are parallel related veins. There is also one very important vein. Which one, students? Yes, it's the great saphenous vein. There are some nerves also specifically in the roof. One is the femoral branch of genitofemoral nerve and other is the ilioinguinal nerve. Those who've done the inguinal canal will know why this nerve has come here. If not, please go and take a look. Right. There are also, can you see a lot of green blobs? These are the lymph nodes, which are referred to as superficial inguinal lymph nodes. So, these are contents of the superficial fascia. Why are we discussing this? Suppose you are approaching the femoral triangle. These are the structures you are going to encounter before you actually reach the triangle. Below these contents is your deep fascia, which is called as fascia lata. What is it called? Fascia lata. Now, as you can see, the fascia lata encloses your thigh like a socks, okay? But it has a little gap in it. The gap is called as saphenous opening. Can you see the saphenous opening there? Okay? And through this saphenous opening, which lies 3 cm below and lateral to the pubic tubercle, structures will pass deep into the interior of femoral triangle or emerge from them. You can see the structures here, which are emerging outside through the cribriform fascia, which covers the saphenous opening. Let's revise this quickly. The entire thigh is enclosed by a deep fascia. The deep fascia has an opening in it called saphenous opening. The saphenous opening is covered by cribriform fascia. The cribriform fascia is pierced by arteries, veins, and nerves as they enter or exit through the saphenous opening. Got that clear? Where is your saphenous opening? It is 3 cm below and lateral to the pubic tubercle. Right. So let's just understand that this roof is not devoid of any applied importance. It is. The veins that are passing through, the great saphenous vein, if it has got valves. If those valves become incompetent, the veins can become elongated and tortuous, resulting in a condition called as varicose veins. Sometimes the lymph nodes, the superficial inguinal lymph nodes, have got a wide area of drainage. So sometimes those lymph nodes becomes very thickened. Okay, and then you must go exploring all these areas which are given here, such as gluteal region, distal vagina, distal anal canal, to look for the possible source of pathology. So even the roof matters, right? So with this we have completed the boundaries, apex, base, roof and floor of the triangle, right? So now what is left? The contents. So let's begin the discussion on contents of femoral triangle. Take a deep breath. Maybe you can have some water or coffee. Okay. And then let's begin diving into the contents of femoral triangle. Right. So, what are the contents? Like I always tell my students, whenever you're looking at contents of any space, remember it's human body. It'll always have arteries, veins, nerves, lymph nodes, fat, and others. What are they? Arteries, nerves, veins, lymph nodes, some fat, and some other material specific to that point. Okay, so which artery will I find in my femoral triangle? Femoral artery and its branches. Which vein will I find? Femoral vein and its tributaries. Which nerves will I find? Femoral nerve and one or two other nerves, which you will see and I'll teach you. Lymph nodes, inguinal lymph nodes. But which ones? You've already seen a pack of lymph nodes. You've seen superficial lymph nodes in the roof. You will find deep lymph nodes in the triangle. What is others? In others, we will include the femoral sheath. So students, these are the contents. We're going to go through them quickly, okay? And just do the basics. Each of them is a lecture by itself, but I'm not going to take that lecture today, okay? Right. So let's discuss each of these, beginning with my favorite artery, the femoral artery, right? So femoral artery enters into the triangle. Please use the diagram to understand, okay? Enters into the femoral triangle by passing deep to the inguinal ligament at the mid-inguinal point. It is enclosed now by the femoral sheath and traverses the triangle, leaving it at the apex. Remember, we've done the apex. While it is in the triangle, it gives rise to a number of branches, which can be classified into superficial branches, which we saw in the roof later, and deep branches. Let's talk about the superficial branches now. Superficial circumflex iliac going towards the anterior superior iliac spine. Superficial epigastric going towards the abdomen. Superficial external pudendal going towards the groin region. Superficial to the spermatic cord. Now let's talk about the deep branches. Deep external pudendal. Profunda femoris. Remember, profunda is the largest branch of femoral artery and supplies almost the entire thigh. Okay, very important artery. As you can see, profunda itself is also giving a number of branches. See these. Okay. And it also gives rise to muscular branches, which we cannot see in this because there are too many. So these are branches of the femoral artery. First content we've discussed is femoral artery. Then we've discussed its branches. We saw that its branches are superficial and deep. The superficial are superficial circumflex iliac, epigastric, and external pudendal. The deep branches are deep external pudendal, profunda femoris, and muscular branches. With this knowledge in brain, let's understand a little bit of the applied anatomy related to the femoral artery. What is it? It's very superficial. It's very easily injured. Okay, so it causes severe hemorrhage since it's almost directly coming from the aorta. It causes severe hemorrhage. Very quick response is essential in such cases. It's a site for arteriography. See, it's very superficial. So it's easy to cannulate. So it's a site from where arteriography is done. Profunda femoris, after being given off, lies very close to your femur bone. Okay, so if the femur is fractured, okay, the fractured end might damage the profunda femoris, or if you are trying to put in a plate and screw things in place to join the two ends also, you may have damage to profunda femoris artery. Okay. The profunda femoris gives rise to an important branch called medial circumflex artery, which is the primary nerve supply to your head of femur. So if that artery is damaged, the patient's head of femur undergoes avascular necrosis. Very important. So remember this. With this, we finish femoral artery and let's go to femoral vein. Here you are seeing the femoral vein, which is ascending up from below. Why am I saying it is ascending? Why should I not say it's descending? Because it's a vein. It's passing from below upwards towards the heart. Concepts. You must always think in the way the organ is acting. Okay. So it's ascending upwards from the apex to the base of the femoral triangle. It is related to the femoral artery. Now here I want you to think something. Okay. Use your right hand for the right side femoral triangle, get your middle finger to cross your index finger. The middle finger is your artery and the index finger is the vein. This is the relation these two blood vessels have with each other in the femoral triangle. Initially, artery is lateral to the femoral vein. At the apex, the artery is anterior to the femoral vein. I hope it helps you to remember. Now, the femoral sheath encloses the proximal end of femoral artery and femoral vein. Note that it does not enclose the nerve. As you can see, the femoral artery receives tributaries. Okay? Its biggest tributary is the great saphenous vein, which itself receives a lot of blood. So, blood coming in the femoral triangle into the great saphenous vein is from superficial circumflex iliac, superficial epigastric, and superficial external pudendal. Also draining into the great saphenous vein is your deep external pudendal. Okay? Carrying blood from all this, the great saphenous vein now drains into the femoral vein, which receives profunda femoris, medial and lateral circumflex femoral veins. Now, this matters because you have to know which vein is draining into which vein. Okay? Study this once, draw it once. It's not difficult for you to really understand or remember for that matter. Right. Each of these veins is provided with valves, the job being to push the blood through superficial or deep veins back upwards towards the heart. Remember, we are doing this against gravity. This is human body, human being who from being a quadrupedal character has become bipedal. So all the blood is going against gravity towards the heart. So these valves matter, this knowledge matters. Okay? Right. Let's talk now about the femoral nerve. The femoral nerve is the largest branch coming from lumbar plexus, L2, L3, L4. Question is it dorsal branches, ventral rami, or is it, how do you remember? So remember one thing, the plexuses are always formed by ventral rami. Only thing you have to really remember is dorsal branches or ventral branches. So in this case, it is dorsal branches of ventral rami of L2, L3, L4. All plexuses are made up of ventral rami. Remember that. Right. So the position. It enters deep to inguinal ligament, one point between iliacus and psoas, okay, deep to fascia iliaca, and it's not a content of the femoral sheath. It lies lateral to the femoral sheath and the femoral artery as seen. Now I want all of you to take that pencil again and let's begin to draw. First draw L2, L3, L4 as shown here. This is the nerve in the pelvis, okay. While in the pelvic cavity, it gives rise to its first branch, the branch to iliacus muscle, a second branch, a branch to pectineus. Have you drawn it, all of you? Please keep drawing. Right. Now after giving these two branches, it passes deep to the inguinal ligament. Now it's in your femoral triangle. Let's see what happens now. After entering femoral triangle, the artery divides into two branches, an anterior branch and a posterior branch. The anterior and posterior branches are formed across the lateral circumflex femoral artery, which is a branch of profunda. So this lateral circumflex actually divides the femoral nerve into an anterior or posterior division. The anterior division, that's the lateral circumflex femoral artery. The anterior division divides into one motor and two sensory branches. Which motor? Nerve to sartorius. Which sensory? Intermediate and medial femoral cutaneous branches, which supply the skin of the thigh region, anterior aspect of thigh. The posterior division divides into four motor and one sensory. For what does it supply? Of course, it supplies the quadriceps. Four quadricep muscles are rectus femoris, vastus medialis, intermedius and lateralis. So these four nerves supply the quadriceps, and one cutaneous nerve given off is the saphenous nerve, which is the longest cutaneous nerve of our body. So that, my dear students, if you have been drawing, is your femoral nerve like this. Just do it this way. You don't have to make pretty diagrams every time. You have to make diagrams that work for you. They make sense to you. That's all. So draw this. Maybe you can pause the video and do this once more, but use this diagram well. Fine. So how will I mark my femoral nerve on the cadaver? I will mark it. I will mark the mid-inguinal point. I will go 1.2 centimeter lateral to it, and then I will draw a short 1-inch vertical line below. That's it. Which means your femoral nerve in the femoral triangle is barely an inch long. After that, it divides into what? Yes, into anterior posterior divisions. By what? Bilateral circumflex femoral artery. Good. Fine. So what are the other nerves I may also see? I will see, now observe carefully. Can you see the arrow there? That is a lateral femoral cutaneous nerve, which is also coming from the lumbar plexus. Importance is that it is passing through your inguinal ligament. If that's the inguinal ligament, it's passing through it. So what happens? Sometimes it gets compressed in the inguinal ligament, okay, causing pain, which is called as meralgia paresthetica. Patient is perpetually uncomfortable. In fact, patients are not happy to sit down because that's when the nerve gets even more compressed. Easy thing is that you release the nerve from the inguinal ligament and patient is absolutely fine. Another nerve you will see is the femoral branch of genitofemoral nerve. See, that's it, okay? It pierces the femoral sheath and emerges out to supply the anterior aspect of the skin above the femoral triangle. So quickly revise, what have we done? We've done the femoral artery and its branches. We've done the femoral vein and its tributaries. We've done the femoral nerve and its branches, lateral femoral cutaneous nerve, and femoral branch of genitofemoral nerve. Artery, vein, nerve done. What is left? What is left is lymph nodes and femoral sheath, and of course there is fat. So let's talk about the lymph nodes now. Take a deep breath. You've done well. Let's go to the next part of the class. Right. I know there are arteries, I know there are veins, I know there are nerves. I also know there are lymph nodes. The lymph nodes in the femoral triangle region are divided into superficial lymph nodes and deep lymph nodes. Superficial are seen in the roof. Deep are seen in the triangle as a content. So superficial are not contents. Superficial are only in the roof. The deep are in the triangle. Let's take a look at an image to understand. Here you are seeing an image. See, here are your upper and lower group of superficial inguinal lymph nodes. I'm not going to bother about them now. But here, this tiny little lymph node is the deep inguinal lymph node. There are 2 or 3 in number. Okay, and these lymph nodes receive afferents from all around. Okay, glans penis, a few superficial lymph vessels, and from here, the efferents begin to go upwards towards the external iliac lymph nodes. So this acts as a conduit for carrying lymph upwards towards the external iliac lymph nodes. So how many lymph nodes in the inguinal region? Superficial and deep. Superficial are in the roof, deep are in the triangle itself. How many deep lymph nodes? 2 or 3. Okay. Right. So we now come to the last part of the class, femoral sheath. As you can see, the femoral sheath is a sheath coming down from the abdomen, enclosing the proximal part of the femoral artery and vein, showing a compartment medially, which is called as the femoral canal. The femoral canal is guarded above by femoral ring and which is covered by femoral septum. The clinical relevance of all this is the fact that sometimes contents of abdominal cavity can pass outwards through this femoral ring and canal, causing what is called as femoral hernia. There's a separate lecture put up on this, so you can cover up the details. Much of the details about this will be covered in that class. So with this, we complete the topic of femoral triangle. A drawing of femoral triangle is being released in the form of a short. I request all of you to go take a look at that. Now let's come to solving a few MCQs, beginning with the same MCQ we started with. I believe that after you have done this class, it will be very easy for you to solve all these MCQs. A request to all of you is that go to my website and solve some more MCQs there. They are put up specifically for you to practice MCQs. Okay? Alright students, with this we end today's class. Femoral triangle in such a short time. Quickly run through it, revise it once, do your diagrams and study the topic well. Okay? Stay happy students. Happiness is a treatment. Thank you. See you across the screen in some other video.